Hello, I am Dr. Jeffrey Nelson. I am board certified in neurology and electrodiagnostic medicine. More important than these credentials, I see patients just like you in my office every day. Thank you for taking the time today to learn about diabetic neuropathy. The most common type of diabetes mellitus is diabetes type 2. Approximately 50% of type 2 patients will develop a neuropathy. Neuropathy simply means problem with nerves. We're not talking about anxiety or nervousness. Nerves travel out of the spinal cord to all areas of the body. They send signals to our brain controlling sensation or what we feel, and send signals from our brain to our muscles to control movement. The longest nerves in our body begin in the spine around the low back and travel all the way to the tips of the toes. With diabetic neuropathy and many other neuropathies, the longest nerves in the body are affected first. This is why most problems occur in the feet. In reality, many types of neuropathies can occur with diabetes. The most common neuropathy impairs sensation or causes pain in the toes, feet, or legs. If pain starts in the toes, it may slowly progress over months or years to involve the feet and legs. Usually, by the time a neuropathy has progressed to the knees, it may also start in the fingers or hands. Many patients ask, what causes the neuropathy? The answer is very complex but involves the poor regulation of sugar in your body. In fact, the greatest risk factors for diabetic neuropathy involve the duration and severity of poor sugar control problems. However, some patients develop diabetic neuropathy with only mild sugar control problems. Your risk of diabetic neuropathy is increased based on other factors such as smoking, obesity, triglyceride levels, and blood pressure. Even after the diagnosis is made, you can reduce your risk of worsening neuropathy by working with your doctor to modify these risk factors. Let's talk in more detail about symptoms that you may experience with diabetic neuropathy. By far, the most common symptom is pain in the feet. The pain is usually described as burning and stinging. The pain may be present all the time or hit you in waves. It may occur only when pressure is applied to the skin or may occur spontaneously. Keep in mind that some patients can have no pain and will experience only deadness or numbness. Numb feet may be a huge problem in patients with diabetes because you may not be able to feel painful stimuli, such as that from uncomfortable shoes or even a splinter. Sores and ulcers may develop without you knowing it and lead to serious infections. In extreme cases, amputation of a limb may be required. This is why most primary care physicians will examine your feet at every visit. Once symptoms of diabetic neuropathy are brought to your doctor's attention, a detailed foot and sensory exam are usually carried out. Blood work and other blood sugar tests may be checked to look for other things that can cause neuropathies. Occasionally, referral for nerve testing or a consultation with a neurologist is requested. Treatment of diabetic neuropathy is a team effort with you leading the way. You must work with your doctor to get even tighter control of your diabetes and triglyceride levels. For type 1 diabetics, tighter control may be obtained by modifying diet, using insulin more frequently, or using an insulin pump. For type 2 diabetics, dietary modification, adding additional medications by mouth, or adding insulin can help. If you are a smoker, ask your doctor for tips on how to quit. Foot care is essential. Here are a few recommendations from the American Diabetes Association. Inspect your bare feet daily for sores, cuts, and scrapes. Wash your feet daily with a mild soap and dry them carefully, especially between the toes. Keep your skin soft and smooth. Use lotion on the tops and bottoms of the feet, but not between the toes. Trim your nails straight across and file the edges with an emery board or nail file. Never go barefoot. Let's move on to medications that your doctor may prescribe. These medications may be very helpful as long as you do your part. Most of the drugs successfully used in diabetic neuropathy come from the anti-seizure or antidepressant class of drugs. In the anti-seizure class, Lyrica and Neurontin are the most helpful. Lyrica has the greatest scientific evidence for its use, but Neurontin is now generic, and many insurance companies request a trial of Neurontin prior to Lyrica. These drugs are thought to work in the spinal cord to decrease pain impulses that lead to the brain. If the nerves from the feet are hyperactive, these drugs dampen those impulses so they don't reach the brain and cause pain. Lyrica and Neurontin have similar side effects, which include sedation and dizziness.
Hi, I'm Christy Franckoviak, registered dietitian. Today we're going to be talking about medical nutrition therapy and the care of the diabetes patient. What is medical nutrition therapy? Medical nutrition therapy is going to include the assessment and deciding on which treatment is best for the patient. And including in the assessment, what we're going to be looking at is getting a good diet history, what the patient normally eats, what their normal habits are, what time they normally eat, looking at their medical background, what other kind of medical problems do they have going on with them, and also looking at their chemistry lab values and incorporating all of these things and finding the best approach for that individual patient. It's going to be a very highly individualized method of looking at things. For most patients, the therapy that's going to include that works best, that we're going to be looking at, is the counseling and then the intervention, seeing what they need to know, where they need to get up speed to best take care of their diabetes. We're going to be looking at it to lead to the development of an individual meal plan. And let me stress again that it's an individual meal plan that we're looking for.